Well, hello and welcome. I'm Dr. JP Monte, and in this video, we're going to be going through my 3 favorite lower body rehab exercises. Now, these exercises can be utilized anytime, anywhere, and are great for warm up as well as cool down after workout, or if you're treating any condition in your lower extremities. So please like, subscribe, and comment to let me know what are some of your favorite lower body rehab exercises. Let's begin. So let's begin by understanding a few important aspects of the anatomy of the lower body. You see, the lower extremities comprising your lower back, your hips, knees, and ankles, and all the muscles that connect to these bones, allowing for the range of motion in these joints. Now, one of the key aspects here is the sciatic nerve, the largest peripheral nerve in the body that comes from the lower lumbar plexus combined with the sacral nerve roots that goes all the way down the leg to the bottom of the foot. And one of the most important muscles that we'll be addressing is the piriformis muscle that comes off the front of your sacrum and attaches to the top of the femur. And any tightness or compression here can contribute to pressure on that sciatic nerve, which can result in sensations and weakness in the lower extremities. So when considering any rehab or exercise, you want to be sure to incorporate all the different motions, that is, forward and back, side to side, as well as rotational movements. So here are 2 simple tests that you can use to assess tension on your sciatic nerve, as well as the range of motion and flexibility of your lower body. So first and simply for the sciatic nerve is the forward bend, where you straighten your leg and just do one at a time, point your toes back towards your face, and slowly bring your forehead in the direction of your knee and see if there's any tension or discomfort traveling down the back of the leg, which can usually indicate impingement on the sciatic nerve from the piriformis muscle or the lower back region. The other simple test is using hip range of motion. And so in this one, simply laying on your back or standing, you want to bring your knee up towards your chest and then let it fall out and rotate around. And you can even place your foot over the opposite knee and do a simple figure 4 stretch. So the first movement I want to show you is the seated sciatic stretch, which obviously done in the seated position. And in this one, you're going to slowly straighten one leg and then gradually look up towards the ceiling. And then you slowly lower the leg down, tuck your chin, and curl your upper body forward, bringing your forehead in the direction of your knees. So do one leg at a time and then alternate. So as you straighten the leg, gradually look up. And then as you bend the knee, tuck your chin, forehead all the way down. So imagine as if you're going to kick yourself in the face and then looking all the way down and who kicked you. And then moving with your breath as you inhale, straighten the legs, slowly looking up. And then as you exhale, tuck the chin, slowly looking down. And when you feel ready, you can also do both legs here, looking up. And then tuck the chin, coming all the way back down. Now I recommend about 10 to 12 for each leg, and then finishing with the figure 4 stretch, where you rotate one foot, placing the ankle just above the knee, getting nice and tall as you inhale. As you exhale, slowly bring your sternum in the direction of your lower leg. Tuck your chin and relax. You can hold for several seconds. When you're ready, tuck your chin, slowly round up. Inhale, exhale, switch sides. Now you can do the same side if one side is more difficult than the other one. Again, on average about 10 to 12 each of these movements, and you can do them daily, twice a day, whenever you get a chance. For example, taking a nice break. If you're seated, working on the computer, it's a great, effective way to not only stretch the muscles and the joints around the sciatic nerve, but to also stretch the piriformis muscle. Now the next movement I want to show you is simply range of motion by creating hip and ankle circles. Now, if you have any balance challenges, please have something nearby that you can hold on to. But you're going to gradually shift your weight to one leg, and you would imagine you're zipping the muscles from your ankle through your hip on that standing leg to activate and strengthen one leg, while the other one begins with the toes slightly pointed down, and just begin with circles. Start off small and gradual, about 10 to 12 each direction, and you're going to slowly make each circle a little bit bigger and a little bit bigger. And then your final one, go really slow and controlled all the way around. Take a moment, shake it out, and then the other direction. Again, standing leg, we want to zip the muscles nice and strong from the ankle through the hip. Please have something to hold on to if you need to for balance, and then simply switch directions. Now I keep the foot slightly pointed down and in to get a good stretch through the hip joint. And from here, each circle gets a little bigger and a little bigger. Now remember that these movements are great as a warm-up or after training and exercise as a cool down to loosen everything back up, or if you're working on any specific condition. And as each circle gets bigger, let your last one be nice and slow, moving all the way around through the full range of motion. Good, shake it out and then repeat on the other side. So zip the muscles of your standing leg. With a straight leg and your toes slightly pointed down and in, begin with small circles, focusing on the motion from your hip and keeping your standing leg contracted and strong. Let each circle get a little bit bigger and a little bit bigger, then finding your full range of motion, moving nice and slow, steadily with control all the way around, and then shake it out and switch directions. And then by doing so, you'll be activating all the muscles of the lower body. And as each circle gets a little bigger and a little bigger, exploring the range of motion. Now listen to your body. Do what you can. If anything feels sharp or too much, back off and then find that edge on the last one, slowly all the way around and shake it out. Very good. Now, specifically for your ankles, and certainly movements that I found very effective as a runner and an athlete, is by using ankle range of motion, by simply going toes up, toes down, doing this several times, and then circles all the way around. And again, you really want to explore the range of motion, get all the cricks and pops out, and then both directions, and on average, about 10 to 12 circles. You can break it up and do 5 each direction and then switch, and 5 each direction, switch. And another one that I found very helpful for ankles and rehab is then to write your name in the air, then shake it out. Now let's go to the other side. Again, start off with just basic toes up, toes down, to loosen the ankle through the forward and backward motions, and then circles all the way around. You want to aim for about 10 to 12 circles in both directions, and this will give you a good indication of muscles, tendons, any ligaments that are tight as you'll kind of feel a little cricking and popping. Now, if anything's too much, simply back off. Always remember to listen to your body, do what you can. The important thing is to do it. Now, after 10 to 12 circles each direction, then you can either write your name using your toes in the air or just simply doing the first 5 to 6 letters of the alphabet. And this will ensure that you get every motion possible in the foot bones and the tarsal joints. Now, the last movement or stretch and movement I want to show you is the deep knee stretch and release. I found this one very effective in treating my own conditions as I've had dislocated knees and multiple injuries over the years with running, doing triathlons, and athletics. And so it's simply sitting similar to Japanese style. You want to keep your knees together and your heels are just wider than your hips. In yoga, this is referred to as hero and reclining hero posture. Now, if you have any deep knee issues, you're going to want to sit on something at first if you're not used to stretching yourself out in this way. Now, you want to hold this stretch for about 20 to 30 seconds. Remember, listen to your body and avoid anything if it's sharp or it's too much discomfort, but you want to feel a good deep stretch. Now what you're doing is by stretching first all the ligaments, tendons, and muscles in the front of your knee, you're also creating compression inside the knee joint itself. And so as you gradually gain flexibility, you're eventually be able to sit on the floor, and then from here you can slowly start to lay back. Again, just going to the edge, holding there with good deep breathing for about 20 to 30 seconds. Now when you're done with the stretch, then you bring your hands flat on the floor and you're going to slowly straighten your legs, and yeah, you can feel the blood rush working through all the cartilage, tendons, and ligaments of the knee. And what I like to do is pedal my knees back and forth and then move into a down dog type of stretch, opening the backs of the knees. Now you can do this stretch anytime during the day. You want to make sure though you have a soft surface under your knees, like a carpet or a mat, and again having a pillow or a block or something to sit on as you're first working into this stretch. And it's effective especially after you do your training, running, or exercise, or working through any knee conditions. Well, thank you for joining me in this video. Please remember to like, subscribe, and comment on what are your favorite lower body rehab exercises. Remember to listen to your body, and the holistic approach is always addressing every condition with the physical, mental, emotional, and spiritual components in mind. And for more holistic, natural wellness information, go to hhcare.org. Please check out my other videos on the YouTube channel, and thank you very much.